Well, we're back with Dr. Michael Cinoman with Cone Health Children's Services for today's To Your Wellbeing. We're talking all things RSV. We've been talking about what it sounds like, what it looks like, what parents could possibly be looking for in their children if they have RSV. Let's switch to prevention. Are there certain things that we can do to prevent RSV or reduce the spread, and do they differ by the age group?
Well, this is a disappointing topic because we don't really have very good ways of preventing RSV. It is a highly contagious respiratory virus that is very easily spread from person to person. Unlike the flu and COVID, we do not yet have a very effective, we don't have any vaccine, in fact, for RSV. They've been working on one for many, many years. Some of your audience may have read that there is some bright spots on the horizon where there are some trials that they've been doing for years on pregnant women, vaccinating them for RSV. What that means is they develop antibodies and they pass them along to the babies. So the babies are born literally with antibodies and immunity in their bloodstream. And the study was very good. It turned out to be very effective at preventing severe disease. But otherwise, it's pretty hard to prevent.
Yeah, when you're talking about like school-age kids and preschool kids, I mean, they're touching everything.
They are.
And you can wipe down things only so much.
Good luck. Yeah, it really is. Essentially, there's really not very effective way of preventing its spread. Clearly, early on in COVID, when it was much worse and the strains of COVID that we had were really very, very dangerous to almost anybody, healthy or not. Thankfully, we seem to have progressed from that, and everybody was isolating and everybody was masking. We saw very little RSV during that time, but that's what it would take. And practically, that's not where we are. So kids are at daycare, they're in schools. Yeah, it just spreads everywhere. It's very, very, very contagious and spready.
Okay, the only thing I'm thinking that like we as adults can do to help reduce the spread is just being mindful once again about the hand washing and not touching things and whatever else.
Sure, and those things are always going to be helpful. I mean, that sort of standard. Wash your hands. Some of the virus is spread by touching things, but mostly it's spread by coughing and air droplets, not actually hand-to-hand touching things. But all those common sense kind of things are good. But we still watch it spread pretty vehemently especially when children are with other children.
Right, okay. Any recommendations on how to protect one another, especially since we're all going to be getting together for Thanksgiving and such?
Other than the things that you've mentioned, unless you're planning on not getting together and not putting people in the same space. But I mean, practically, I don't think we're really recommending that people do that. At this point, we've been through a lot of that with COVID, and I think there is a lot of RSV out there. I would say if you're going to be cautious about anyone, it's really the little ones that are most susceptible. Children under a year or 6 months of age, watching them around people who have cough or congestion is probably a good idea because they're really the most susceptible. But when you're older than that, 3, 4, 5 years of age, I just wouldn't, it is what it is, and people are going to get exposed and get their colds. It's really the little babies we worry about the most.
All right, do we think this surge of cases might burn itself out, or we think it's just going to return to the same kind of high levels as we go throughout winter?
That is another $1 million question. That's a great question. I don't think anybody knows the answer to that. Every time I think it has started to slow down at the hospital and the emergency department, it keeps on coming. Sooner or later, yeah, most people are going to get exposed and have antibodies to it. And then probably it will, if you'll pardon the term, burn itself out, and we'll see it less frequently. But right now, it's still going pretty strong.
All right, so be mindful. If you're the one coughing and hacking, you're not going to be touching or playing with the kids at the moment, right? I mean, that is at least something you can do anyway. All right, thank you, Dr. Cinoman. We appreciate your time and your expertise. Lots of good information here, folks. We want to make sure that you have it all. So you can check out the To Your Wellbeing section. We'll have all of the interviews posted shortly.